you very much, Dr. Lin. Thank you, everybody that is here joining us today. Yeah, it's for me an honor to present to you about this really wonderful subject, one of many subjects. But let me just share my presentation here with you so that we can start this presentation. There. There. Please, Dr. Lin, let me know if this is good.
This is perfect. Thank you.
Perfect. Okay. Thank you so much. I'm just going to move this little square here. There. Yes, as introduced, vaccination against necrotic enteritis due to Clostridium perfringens in broiler chickens. It's a mouthful at the beginning of the year. And with this, I want to wish you a very good 2022 as well. And I hope you will enjoy this, this presentation and as many questions as you want after this or afterwards per email as well. So let's go ahead here. As you can see in the title, there are three main subjects or three main sections in this presentation. First section will be Clostridium perfringens. The second will be about vaccination. And the third will be about data, presenting data in broiler chickens. So first of all, we start off with Clostridium perfringens as a cause of necrotic enteritis. A little bit of introduction. Clostridium perfringens, we have all heard the name. Formerly, it was named Bacillus welchii. It was renamed after to perfringens from the Latin burst through, which you will see in this presentation is exactly what it does. But to put it a little bit simple and schematic, we start off with this little guy here. And you could say that it is everywhere in your environment, you will find this little guy back. And this is your Clostridium, typical Clostridium perfringens. But what it likes most of all is to be in your gut, as you schematically see here, because there is no oxygen. That is what they like. They don't like oxygen. So looking at this a little bit more in real life, it looks like this. Actually, much more or less like what we have seen in the schematic picture there in the previous slide. And it is a gram-positive spore-foring bacillus. Again, a mouthful. Gram-positive because the ones amongst us that are familiar with gram staining, you use a iodine treatment and it does not decolorize afterwards, so it stays purple. Otherwise, it would stain pink, as you would see on the scheme here. So purple means gram-positive. But that's not what we're talking about today. We're talking again about the little purple guy, and we know that we can just live with it together as we have done for millions and millions of years, because that is actually how long it already exists. It just coexists with us. But at some times, there are influences where this little guy is not so beneficial to us and actually gets really bad. And that is with intestinal damage. That can be of all sorts. You know, Emeria coccidiosis very well as a predisposing factor. Nutrition is one. There are many others. So when this happens, those little ones will start flourishing and produce what we call virulence factors. They are toxins. Can be toxins. There are different others. We will explain a little bit further. But when that happens, those toxins actually are the cause of the performance loss, of mortality, and the cause of necrotic enteritis and all the associated negative effects. So taken together, when this happens and you have all of those bad guys in your gut producing those toxins or virulence factors, you may understand very well that chickens do not really like that. Moreover, Clostridium perfringens is a bacterium that likes meat. It's a flesh-eating bacteria. In fact, it is an oxotrophic bacteria, actually a scientific name to say that. It needs some things from its environment enable to stay alive. So 16 amino acids. You can already see that it likes protein a lot. And this is important in the further story about this bug. We know a lot about it. We know the genome, we know it is a flesh eater and so on, and that is good because we know Clostridium perfringens as a cause of necrotic enteritis is, as Dr. Lin said, this is just causing some major challenges in our industry. We also know, and you know this picture very well, that there is a very clear clinical form, but also a subclinical form, which is most important because that most of the time, or it can go unnoticed, and it reduces your growth, your feed efficiency, your economy. There are some numbers, of course, about that economy and losses per flock. This is already a study of 2010. But anyway, we know that it is causing a lot of damage, or can cause a lot of damage in our industry. Every year, we know the United States reports on animal health, and we see it coming back over and over again as major broiler disease issues, necrotic enteritis, and associated with it, coccidiosis. On the other hand, and that is also what we see in Canada, that there are other types of issues as well, meaning that there is, and even more so, restrictions on antimicrobial usage. And indeed, that lack of efficacious alternatives to antibiotics was ranked as also in the top 10, and even spot number 1, 2, or 3 over the past years. But if we talk about this and the economic impact and all of that, we do have to know that Clostridium perfringens is something that is so variable. And we talk about types, or even more specific, toxinotypes, if you want to understand better what type you are dealing with. And that can be very various, because we have talked about toxins, we can talk about enzymes, we can talk about all other types of virulence factors, but also those exotoxins. That's not just one, there are even several that cause disease and reduce performance. And there's been publications on that, luckily, that investigated what is exactly what. So if you look at the green squares, because that is where we would like to focus your attention, then we see the toxins that are associated. So you see here on the left-hand side, alpha toxin and then a B toxin, associated with the diseases that are caused. And you see it is a variety of diseases, but necrotic enteritis in the bird has been squared. You see that that is alpha toxin and that B toxin. So certainly that will be the further subject or the further focus of this presentation. So there's, as you can see, 2 major toxins associated with necrotic enteritis in broilers. So those 2 toxins, what are they? We have then alpha toxin. For many years, this toxin has been considered major for the development of necrotic enteritis. Many publications have been written about it, but more recently, the net B toxin has been identified as a critical virulence factor for the development of necrotic enteritis. So it is definitely not only one toxin that may be important in the development of necrotic enteritis in broilers, but both of them are extremely important. So what is this actually? What does it do? A little bit of detail, not too much, but just letting you know that the alpha toxin is a protein, is an enzyme that acts on fat, like fat as in the layer of your cells. So it really cuts open cell membranes, which we do not like, of course, in the bird, because we need our gut cells to be able to absorb the nutrients that we have and able to produce meat. So this actually cuts open those cells. You can understand that that is not good. And they even do it in a calcium-dependent manner. You see that also the calcium level in feeds can become increasingly important when talking about Clostridium perfringens. This toxin, the alpha toxin, is found in all of the Clostridium perfringens strains. So if you talk about any type of strain that can infect the bird, but also a pig, also the alpha toxin is present in all of them. Then you have the net B toxin, the second most important toxin, or the other very important toxin. What is that? Potentially even worse. The net B toxin is a toxin that creates, I'm not going to go into detail of this graph, but you see the green structure here, which is actually a pore in the cell membrane, which could be the cell membrane of the gut. So when you create pores, of course, your cells will lose some very important molecules that they need for their cellular metabolism. And hence also you create ruptures in the gut as well. This is really critical for the development of Clostridium perfringens, necrotic enteritis in broiler chickens. So NETB is a critical factor and a very important toxin for that. I'm just giving one example here. There's many other examples, but for instance, next to the alpha and the NETB toxin, who are extremely important, we also have, for instance, the CA locus. And I'm just saying this because we talked about the chicken patty and the meat-eating bacteria before. This is a collagen adherence locus, and collagen is actually the substance where all your cells are in. You understand that that is actually some type of very important structural tissue. Of course, if you start associating with that, adhering with that, and destroying that, then you take away the base layer of your intestinal, of the intestine that the bird needs for its digestion. And this locus is mainly found in that B positive Clostridium perfringens, so the ones that are actually causing the real damage in broiler chickens. This as an example. Now, taking all of that together, I wanted to just schematically show in this graph by Goossens et al. From the University of Ghent, what exactly happens. Just to focus on the toxins here. And this is an hypothesis on key events that happen when you have Clostridium perfringens in your intestine. I would like to ask you to just focus here on the orange above and on the little bits and pieces underneath of that orange, because the orange is the bacteria, so the Clostridium perfringens, and all the little bits and pieces is what we call those toxins or virulence factors, including the alpha toxin. So you can see that it is exactly the toxins that are causing the release of the basement membrane and also the interaction further with the immune system. So it is really that causes the harm and the tissue necrosis and not the bacteria itself. Now, to go a little bit into the clinical presentation here, because as a veterinarian, I do want to show you some bloody pictures of intestine. That is what we thrive on, okay? So this is also a publication by Goossens, pointing out that, okay, we have necrotic enteritis, but we also have, as described, necrohemorrhagic enteritis, which is actually differently associated with different toxins, okay? I understand it is quite complex, the different toxins, the different clinical presentations, but we want to be as let's say, we want to be complete in this presentation. So I do want to talk just briefly about this as well. There's a table following, okay? I'm going to guide you through. You see here the classical or the non-hemorrhagic necrotic enteritis, typically associated with the NETB toxin. As we already said, that is what we would call the necrotic enteritis as we see it most of the time, okay? Typically in 2 to 6 week old broilers associated with the NETB toxin. What are the risk factors? Nutrition, polysaccharides, emeria, coccidiosis, okay, the typical. The necrohemorrhagic enteritis is also called necrotic enteritis, but we have seen that those types are not associated with the NETB toxin, actually rather with the alpha toxin. You see, there are some different clinical presentations pointing out in different associations with toxins, okay? Sudden increase in mortality, so not so subtle or subclinical, and mostly associated with type A, so alpha toxin is involved. But you see, taken together, the two toxins always come back, but still the clinical presentation can be a little bit different. We have some pictures of that as well. So we see, okay, the pseudomembranes, etc. They come back every time. We are talking about necrotizing enteritis, so that is something that they have in common. But you do see definitely the bloody effect here of this type of necrotic enteritis, and usually mortality without any clinical signs, whereas this is mostly subclinical or then acute forms. But okay, this is all very much described in this publication as well. And I did wanted to show you differences. Okay, there's not just one type of necrotic enteritis. Now, if we look at the totality, so the different toxins and all of that, we of course have to have a certain total approach of this. Different factors are involved, and we wanted to give you some summary of those factors. Okay, so if you see here, the 3 dots above here, you see management, anticoccidials, and nutrition and digestibility. Those are basically the base things that we need to have in order to combat necrotic enteritis. And those basic needs also correspond with the basic risk factors. If you look at risk factors for necrotic enteritis, the most important ones are coccidiosis, nutrition management, as given here on this, this graph as well. Of course, we have many other things that help us in dealing with this. We have our approved products with the claims against necrotic enteritis, so that's medication, different types of medication. We have, of course, a vaccine as well, which is now recently on the market. And for sure, there are some other good health supports or feed additives that we can use to help gut health. Now, going into the registered products, so actually with the necrotic enteritis claim, then we have our medications. We all know them very well. We have Vaccination, so an aid in the treatment or reduction of early mortality or prevention. And then prevention also is avolamycin. So we have medications that, as we say, directly target the bacteria. From what we have said above, is clear that the bacteria themselves, okay, they are of course important because they produce the toxins, but it is the toxins that will actually be responsible for all the lesions and lower performance that we see in the field. So when we talk about this targeted immunity with a vaccine, now we are talking about other types of targets, and we're going to have go through that in the next section here. So that's the vaccination against necrotic enteritis, which is available now. A little bit of an introduction on vaccines and vaccination. And we know with the current situation, even with us, yeah, we have heard about vaccination a lot. Vaccination, I just looked this up, really, to have the most complete definition of all. And it basically says any preparation of immunogenic material to be able to stimulate your immunity without, of course, inducing any disease. It can be based on a lot of things, altered toxins in this case, because that is what we will be talking about with the vaccine as well, viruses, microorganisms, and so on. And this is an example. I thought it was applicable and funny at the same time. So the name vaccine comes from the Latin vacca, which is cow, because it was extracted, let's say, from the cowpox virus, where we vaccinated in mass for, yeah, actually not so long ago, even in certain countries of the world. So that is where the name vaccine comes from. Of course, you have to have a certain technology, and for every vaccine, it is a little bit different. Most of the time, it is a little bit different. In this case, we're going to talk, of course, about the technology that was used for the necrotic enteritis vaccine. In general, you need a vehicle, of course, because you have your certain pieces of protein. It can be a toxin, it can be bacterium, it can be, okay, immunogenic material. You have to have a vehicle to get those pieces into the right place and in the bird's immune system. And a vehicle, okay, we represent it here with a very nice car. In this case, our vaccine has an RASV. RASV is the short for recombinant attenuated salmonella vector, which means that we use another bacterium as a vector to get close to the bird's immune system. Is this something new? No, this is not something new. You can see here from this introduction at the Lake Louise seminar in Banff that in 1989, we already talked about this type of technology. It has been well studied, documented, published, etc. But of course, coming from some molecular genetics to a vial of vaccine in your shelf, in your fridge, that takes a bit, of course. We were not alone to do this. So we have partnered up with Curtis Healthcare, biopharmaceutical company, that developed this platform for new vaccines. Are they new to our world? No, Curtis Healthcare is definitely not new to our world. They published about this and did research about this vector already a long time. You see it 2010, but even before that, of course, they studied this technology. Now, the technology was developed to achieve two main objectives. So first of all, the vaccine should survive long enough to colonize the lymph tissues, because in the lymph tissues we have immune response and immune development, or the start of the immune response. Secondly, of course, or as important as point number one, the vaccine cannot cause any clinical disease. So to do this, we created this vector, this vehicle, in such a way that the salmonella can grow to a very, let's say, short duration, very limited in the bird, but doesn't cause any clinical disease. And it will die off very rapidly after certain amplifications. Why? Because we made some genetic alterations to that vector that it needs certain factors, like specific sugars, to be able to grow. So you can understand that if we put this vector, this salmonella that we created, in a petri dish, and we add the sugar on the petri dish, it will of course grow. On the other hand, if you take the vector, or the vaccine, in other words, and you put that in a bird, those sugars in the bird are virtually absent. So the vector will not grow, and that salmonella vector will not replicate in the bird. And more importantly, it will not spread to birds that do not have had the vaccine. So a little bit more detail on the composition, but that is, let's say, the maximum of detail that we go into. We have the vector. You see, this is a bacterium. This here is the bacterial DNA, circular DNA. Then we have the plasmid, which is a piece of circular DNA that we will put into the bacterium. That will code for alpha and B toxin, you know, the two most important toxins that we have associated with necrotic enteritis and the various clinical types, as we have shown. And taken together, you get a bacterium that will produce antigenic material, the alpha toxin and the net B toxin. And you bring this into the immune system, then that gets a stimulation, and you will generate, or the body of the bird will generate, mucosal antibodies. Mucosal is very important. Mucosal means that it is exactly at the intestinal cell lining that you will generate most of the protective molecules against necrotic enteritis. So that is very important, that you will generate antibodies at the right place where the immune reaction needs to happen. When we vaccinate, we can, we're going to click further just to make it easy. We have an early stage, an intermediate stage, and a late stage. So this vaccine vector was developed in such a way that it cannot maintain itself very well. So it will die off, and it will do that within a week's time. So you will not see any of that salmonella anymore beyond 7 days. This brings us to a little summary here on the vaccine. So we know alpha and B toxin are important. This vaccine generates antibodies against two of these very important toxins. And you can just vaccinate at the hatchery birds at day of age. So this is the alternative, let's say, in the claimed necrotic enteritis products repertoire. Now some data. These data will be on medicinal products, on the vaccine, a little bit about safety, a little bit about efficacy, so that you have an idea how to position the vaccine and what it can mean for our industry. We were able to gather some data also on medications. These are published data. This is, for instance, bacitracin. You know, bacitracin is extremely important for the treatment and still now prevention of necrotic enteritis. I will guide you through this figure here. So here you see on the left-hand side a graph on percentage of mortality due to necrotic enteritis. And on the same birds, here on the right-hand side, you see the feed conversion of those birds. We have a no, a yes, no, and a yes, BMD. The no, the first no means, has the bird been challenged with Clostridium perfringens? In the first case, that was no. In the black bar, it is yes. And in the green bar, it is yes. Then medication, yes or no. In the gray bar, it is 2 times no. So basically, this is our control group. We didn't have any challenge and the birds weren't medicated. They just ran along in the study. The second group, the black bar, was challenged but didn't receive medication. So you can imagine that the feed conversion is not so good and the mortality will be higher. And of course, we have one that is challenged, but with medication, so with the BMD. So you see, of course, mortality here increased from the normal births, 2.8 to 4.6, 4.7 almost, which is an increase in mortality, though a slight, relatively slight increase in mortality. But you see that medication indeed brings you a significant response on mortality. On the other hand, you see on feed conversion that there was no significant difference between the two feed conversion here. When you look at the BMD treatment, although there was some decline in the green group. So that is one published study that we can find on bacitracin. The reason why we incorporate these figures is just to give you an idea. Okay, this is what has been published on the different claimed necrotic products with a necrotic enteritis claim and how they can relate to one another. Right? So we have the same about avilomycin, and it is clear here that, okay, the challenge with necrotic enteritis with Clostridium perfringens gave a lot bigger percentage of mortality, 31%, so that is a clear challenge. Same thing applies here, so no is our control. Yes, no is, yes, we have infected them, but they didn't get any medication. And here you see different concentrations, let's say, of avilomycin, 15 ppm and 30 ppm. Again, on the left-hand side, we have mortality. So you clearly see a distinct effect on mortality with avilomycin. And here we have feed conversion, where here, again, a distinct effect with the avilomycin on feed conversion in infected birds. However, the two doses weren't significantly different. So that for avilomycin, but definitely a good infection in this case. The same we did for the vaccine. The groups were here, 4 groups. I will explain why. Okay, so this is an approved infection model by the USDA and the Canadian authorities. T1 is the 2 times no, so we didn't have any challenge at all. Treatment 2 is an Emeria challenge. So we add the Emeria challenge to make the birds more prone to really have that Clostridium perfringens effect when we challenge them with that. Group number 3 is no vaccine, but the double challenge, so the full challenge with Emeria and Clostridium. And group number 4 is the vaccine and the double challenged animals. And now we're going to go into similar graphs as we've shown in the previous slides. So these graphs will be 3 graphs on mortality. So you can see T1 is nothing happened. T2 is an Emeria challenge. T3 is the Emeria and Clostridium challenge, and you can see again a very good challenge, like with the avilomycin study, 30% mortality. I mean, that's a clear challenge. And then going down. Okay, so if you vaccinate the birds, you will see that when they're challenged, the mortality will drop down to, in this case, 8.3%, in another study to 13.1%, and in another study to 17.2%. So these trials were done in the light of our registration as well. So these are publicly available figures that you can consult online. So you can see that this vaccine reduces mortality due to Clostridium perfringens. If we look at feed conversion and growth, and I'm going to pop up the second slide as well, you see the same. So T1, same groups reappear, no, only Emeria challenge, the full challenge with Clostridium and the vaccine. In this case, yes, there was a significant effect on feed conversion, and there was a significant effect on growth as well when comparing the same groups with and without vaccine. So in this trial, it enhanced performance. However, we have to be clear on that there is a potential. For instance, in this trial, AMA didn't give any significant reduction in feed conversion, and also no significant difference in weight gain. Taken together, we've done this big summary of data that we gathered in the States. And just to give you an idea about what it can mean in the field, because of course these are not field trials. In this case, no influence on performance. If we look at the United States and we take winter to summer 2021, and we gather all the data from many different producers, then you can see the next, okay? So first going to guide you through the groups. We have the Clostridium perfringens type A vaccine, which is the same as the standard next to it, but the only difference is that these birds have gotten a vaccine at day of age at the hatchery. You see how many birds were placed, how many birds were sold in the end, and the liveability as well. And here is the variance. So if it is a positive number, that means that it is better. So we did have overall a higher liveability, taking all data together. The average weight went up a bit. Condemnation rate was a little higher, 0.02%. On feed conversion and adjusted feed conversion, we also were more in favor. Of course, and I must say, these are all birds together. So these are rather conventional birds, RWA birds, ionophores only birds. You know, you have different labels in the United States. Necrotic enteritis, history, no necrotic enteritis history. So all kinds of birds taken together. We did have seen the different individual situations, a lot of variable results depending on if there was already a problem with necrotic enteritis, yes or no, and so on and so on. We know that can be true for Canada as well. But all in all, very promising and very good results, as we are confirming now in the Canadian industry as well. Very important is this here. So tissue dissemination, tropism, and persistence. This graph shows you different tissues, as you can see here on the left-hand side. And then we have 0, 1, 2, 3, and so on days post vaccination. This study assessed the presence of the Salmonella vector post-vaccination. So you can see, for instance, in the Zika, we did find some of the vector back up until 6 days, but 7 days post-infection, we didn't find anything back. The same in the reproductive tissues, meaning that if you vaccinate the chickens past a week of age, you will not find this vaccine vector back in any of the tissues in the chicken. The next slide, and also very important, did not persist past 7 days, so very safe in terms of persistence in the tissues, definitely. also very important and a question that is frequently asked. So how about shedding and spreading? So if we look at this graph, you can see that, okay, again, different samples. You have ceca, spleen, reproductive tissue. But these were the ceca and spleen and so on of non-vaccinated contacts. So we vaccinated chickens. We put them together with non-vaccinated chickens and checked if the vaccine vector, so the salmonella, would spread amongst chickens, which it doesn't. Okay, so it was not recovered from all tissues or any tissue that we selected for in any of the naive contacts. So it does not spread to non-vaccinated contacts. And I do understand this is only one graph. It comes with like a package of the full study. So we do have a big report of this, but just showing in one graph, like this is a safe vaccine, doesn't spread in your flock, which makes it, of course, important to vaccinate very well. The vaccination needs to be very efficacious of the individual bird. Well, we come to the final part here, a couple of slides, and as a take-home message, so in brief, I'm gonna click further, yeah. So necrotic enteritis, we know it is a global thing. It is also, yeah, is it re-emerging? Yes, actually it is. It has also some human health impact and so on, Clostridium. It's not only an animal thing. We do have antibiotic-free production systems that are eliminating or already have eliminated traditional necrotic enteritis control. And still we're working also in Canada, not only in Canada, but also in Canada, towards reducing some antibiotics for prevention. So we need to be careful what we will be having as alternatives in the future. And the platform, so the vaccine platform is one thing. So we have this RASV platform to stimulate a very good mucosal immune response, which is extremely safe. And ensures biological containment as well. And that is used to get this vaccine ready for us. So it's the only vaccine that is available to control necrotic enteritis, mass administered to day-old birds. And it's also the only one stimulating immune responses to the most critical toxins that we have produced by necrotic enteritis. And of course, it's been approved. I mean, it meets all the standards, and it does significantly reduce the impact of necrotic enteritis in our broiler chickens. And with this, yeah, I want to conclude and say that it has been a pleasure presenting with you. And I see that there are some numbers there at the Q&A, so I'll be very happy to take your questions. If there would be other questions, my email address is there. You can also call me and I will be happy to answer your questions. I'm not going to stop sharing. Where do I do that? Stop share? Yeah. Okay, there we are.
Thank you so much, Dr. Decay. Sorry for that very thorough introduction of necrotic enteritis and the interventions as well. So we do have quite a bit of time for questions. Yeah. And maybe I'll start with the first question is, can this new vaccine be used when the birds are older? So the age, like when the vaccine application?
Yeah, very, very good question. And the answer is, I'm gonna say yes, but I'm also gonna explain a little bit how that would be done. Okay, the answer is yes. We have 2 product presentations in Canada. 2 product presentations are lyophilized vaccine and fresh frozen vaccine. Our lyophilized vaccine is labeled to administer at day of age in the hatchery. And that is also the vaccine that we commercialize due to practical reasons. I mean, lyophilized is just so much easier to bring to the market. Of course, we have the label of our fresh frozen as well. And our fresh frozen has on the label administration at day of age, and also the booster at older age. If I would say that you can use that or promote that, for instance, for the lyophilized, that would be unwise, because that is off-label use. However, fresh frozen, okay, we do have some recommendations how to use that at an older age as well. That being said, I would like to conclude that all the research and field experience that we have with the vaccine does not justify the use of the application of the vaccine at an older age, because it is very efficacious for the ages of our broilers. And the ages of our broilers, I mean, it could be 32 days, could be 36 days, but we know in the States we sometimes have 42, 49, and so on broilers, where it still has been shown to be very efficacious only with a 1 dose at hatchery. So I hope that answers the question.
Thank you. And I think this, maybe I'll jump to this related question. You probably have answered this already, unless you have some more to add on. It's, what is the current recommended method of application for this vaccine? I think you have covered the most part.
Yeah, that would be day of age at the hatchery. We know hatcheries are so efficacious in administering vaccines. It is also dosed in such a way that you can dose it together with your bronchitis vaccine. It is mixable. We have tested that as well. So there's no interference when mixing them together. And that is by far the most efficacious way. We have had questions as well as, and can I give it on the farm when my chicks are day of age or come into the barn? And we do have recommendations for that as well. But by far, we do recommend the hatchery for the most efficacious. I mean, hatcheries, that's their specialty, you know, for the most efficacious vaccination. Yeah.
And our next question is, are there any precautions when vaccinating with coccidiosis vaccines?
Oh, good. Yeah, also, we have tested 2 different cocci vaccines while mixing it together with the necrotic enteritis vaccine, okay? That is Advent, so one of our vaccines that we commercialize in the United States, and Coccivac, okay? Both of those vaccines mixed together with the necrotic enteritis vaccine didn't show any interference whatsoever. So we would say that it is safe to mix them together and administer them together.
I think you have mentioned also some safety study on the slide as well too. That's,
yeah.
Thank you. And then the next one is that you've mentioned the 2 important toxin that causes necrotic enteritis, and it's wondering if the toxin binders used for feed has any effect in binding them.
That is a very interesting. Who asked that question now? That's very interesting, and it's the first time that I get that question. I have been developing in a former life mycotoxin binders as well, so I may be able to comment. The first thing I gotta say is we have not tested this, so we can never be sure. Now, knowing from mycotoxin binders, because I do believe that is the question where it relates to, whether this has to do with nutrition, knowing from toxin binders, they work actually as some sort of sponges. Actually, they're porous in structure, and there are different types of pores and sizes. Let's say grid size, it works almost as a sieve to be able to bind those toxins. Now, the structure of a mycotoxin and the structure of the alpha and the net B toxin is a little bit different. So it is actually very interesting for the research and development brain that is now working in me, but we can never be sure. We need to have the right pore size, but it's a very interesting question to ask. Of course, then we do this in a very non-selective way. Mycotoxin binders are also things that we know are a mass product. You dose that at 1 kilo, 2 kilos per ton of feed, and it just works on the amount of bulk that you put into the gut of the chicken or the pig, or it doesn't matter which. Whereas, of course, it is always more efficient to use the own body to produce things that capture bad things, like the immune system. Okay, so the immune system knows exactly what the bird needs when it is vaccinated. It will work with the bird. The immune system of this bird and this bird and this bird, okay, they're all the same genetic, but it will be all a little bit different. And what is done by the own body, from my experience working with nutrition, is always more efficacious and more, let's say, has more potency than what we want to put through feed as a bulk, if that makes sense. So own produced antibodies are always more powerful and in the correct amount as it suits the physiology of the bird than, okay, trying to bind it with a bulk in the gut. But I'm not saying that it is impossible. I don't think it is researched yet. And I would be surprised with the molecular size, but okay. Yeah, now my brain is, I'm talking too much. Next question.
Thank you. Next question is the vaccination given to breeders to offer protection for the broilers? That's a really interesting question.
Yeah, that is a super interesting question. Point number one, adding it to or vaccinating breeders or any species that is a non-broiler chicken is off-label use. That being said, okay, the stimulation of the immune response is in such way that you will generate mucosal immunity predominantly, which means that every bird individually needs to have the vaccine in order to generate that immunity. We're not saying that there's not any systemic immunity developed. That is, of course, the case, because you have to take into account, okay, look, you have your vaccine, it comes into your gut, it comes into contact with your mucosal, and let's say, I'm not going to make it too difficult, but with your mucosal immune cells. Those cells will take it up, bring it through the lymph, through the blood, into the lymph nodes. And chickens have various lymph nodes other than pigs and so, but that is out of the question. Bring it to the lymph nodes, and of course, generate systemically antibodies. So they will circulate, but they will circulate predominantly to the gut of the bird, because that is where the initial immune response took place. Okay, so yes, it could be that there is some transition. We haven't assessed that yet because it now is only approved for use in broiler chickens to individually immunize those chickens. I would say it is rather the mucosal immune response of the individual bird, and we're not looking into, okay, that effect specifically. No. Have a great day, everyone. Thank you.